Shaving using a safety or disposable razor. 8. Soften the beard with a warm, wet washcloth on the face for a few minutes before shaving. Lather the face with shaving cream or soap and warm water. Warm water and lather soften skin and hair and make shaving more comfortable. 9. Hold skin taut. Shave in the direction of hair growth. Shave beard in short, downward, and even strokes on face and upward strokes on neck. Rinse the blade often in the basin to keep it clean and wet. Shaving in the direction of hair growth maximizes hair removal. Figure 6-25, caption, holding the skin taut, shave in downward strokes on face and upward strokes on neck. 10. When you have finished, wash and rinse the resident's face with a warm, wet washcloth. If he is able, let him use the washcloth himself. Use the towel to dry his face. Offer a mirror to the resident. Remove soap, which may cause irritation. Promotes independence. Shaving using an electric razor. 8. Use a small brush to clean the razor. Do not use an electric razor near any water source or when oxygen is in use. Electricity near water may cause electrocution. Electricity near oxygen may cause an explosion. 9. Turn on the razor and hold skin taut. Shave with smooth, even movements. If using a foil shaver, shave the beard with a back and forth motion in the direction of the beard growth. If using a 3-head shaver, shave the beard in a circular motion. Shave the chin and under the chin. Figure 6-26, caption, shave or have the resident shave with smooth, even movements. 10. Offer a mirror to the resident. Promotes independence. Final steps. 11. Apply aftershave lotion if the resident wants it. Improves resident's self-esteem. 12. Remove the towel. Place the towel and washcloth in the proper container. 13. Clean the equipment and store it. Follow facility policy for a safety razor. For a disposable razor, dispose of it in a biohazard container for sharps. For an electric razor, clean the head of the razor. Remove whiskers, recap shaving head, and return razor to case. 14. Remove and discard gloves. Wash your hands. Provides for infection prevention. 15. Make sure that resident and environment are free of loose hairs. 16. Return bed to lowest position. Remove privacy measures. Lowering the bed provides for safety. 17. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 18. Report any changes in resident to the nurse. Provides nurse with information to assess resident. 19. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Learning Objective 5. List guidelines for assisting with dressing. Dressing and undressing residents is an important part of daily care. When helping with dressing, the NA should know what limitations the resident has. Residents may have one side of the body that is weaker due to stroke or injury. That side is called the weaker, affected, or involved side. The NA should not refer to the weaker side as the bad side or talk about the bad leg or arm. When dressing, the NA should begin with the weaker side of the body. This helps reduce the risk of injury. The weaker arm is placed through a sleeve first. When one leg is weak, it is easier if the resident sits down to pull the pants over both legs. Guidelines, dressing and undressing. Ask about and follow the resident's preferences. This is part of promoting person-centered care. Let the resident choose clothing for the day. Check to see if it is clean, appropriate for the weather, and in good condition. Figure 6-27, caption, when dressing, the NA should start with the affected, weaker side first. Encourage the resident to dress in regular clothes rather than night clothes. Clothing with elastic waistbands and clothing that is a size larger than normal are easier to put on. Let the resident do as much to dress or undress himself as possible. It may take longer, but it helps maintain independence. Ask where your help is needed. Assistive devices for dressing are available. Use them as directed. Figure 6-28, caption, special dressing aids promote independence by helping residents dress themselves. Photo courtesy of North Coast Medical Incorporated, www.ncmedical.com, 800-821-9319. Provide privacy and never expose more than what is necessary. Roll or fold socks or stockings down when putting them on. Slip over the toes and foot, then unroll them into place. For a female resident, make sure bra cups fit over the breasts. A front fastening bra is easier for residents to work by themselves. A bra that fastens in back can be put around the waist and fastened first. After fastening, rotate the bra around and move it up. Arms can be put through the straps last. This can be done in reverse for undressing. Place the weaker arm or leg through the garment first. Then help with the stronger arm or leg. When undressing, do the opposite. Start with the stronger or unaffected side. Procedure. Dressing a resident. Equipment needed. Bath blanket. Clean clothes of resident's choice. Non-skid footwear. When putting on items, move the resident's body gently and naturally. Avoid force and overextension of limbs and joints. 1. Identify yourself by name. Identify the resident by name. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for resident's privacy with curtain, screen, or door. Maintains resident's right to privacy and dignity. 5. If resident is in bed, adjust bed to a safe level, usually waist high. Lock bed wheels. Prevents injury to you and to resident. 6. Raise head of bed so that the resident is sitting up. 7. Ask resident what she would like to wear. Dress her in the outfit she chooses. Promotes resident's right to choose. 8. Place a bath blanket over the resident. Ask her to hold on to it as you remove or fold back the top bedding to the foot of the bed. Remove the gown or top. Keep the resident covered with the bath blanket. Take clothes off the stronger side first when undressing, then remove from the weaker side. Place top clothing in the proper container. Move the bath blanket down to cover the lower body. Maintains resident's dignity and right to privacy. 9. Help the resident put on the top. If the top goes over the head, slide the top over the head first. Then place the weaker arm through the sleeve before placing the garment on the stronger arm. Help the resident lean forward and smooth the top down. If the top fastens in the front, slide your hand through one sleeve and grasp the resident's hand on the weaker side, pulling it through. Help the resident lean forward and arrange the top across the back. Pull the second sleeve onto the stronger side as you did with the first one. Fasten the top. 10. Remove the bath blanket and place it in the proper container. Help the resident put on a skirt or pants. Put the weaker leg through the skirt or pants first. Then place the stronger leg through the skirt or pants. Have the resident raise her buttocks or turn the resident from side to side to pull the pants over the buttocks up to the waist. Fasten the pants or skirt if needed and make sure the clothing is comfortable. 11. Roll one sock over the weaker foot. Make sure the heel of the sock is over the heel of the foot. Make sure there are no twists or wrinkles in the sock after it is on. Repeat for the other foot. Promotes resident safety. 12. Starting with the weaker foot, slip on non-skid footwear. Use an assistive device if needed. Fasten one shoe securely and then put on the other shoe. 13. Finish with resident dressed appropriately. Make sure clothing is right side out and zippers and buttons are fastened. 14. Return bed to lowest position. Remove privacy measures. Lowering the bed provides for safety. 15. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 16. Wash your hands. Provides for infection prevention. 17. Report any changes in resident to the nurse. Provides nurse with information to assess resident. 18. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Intravenous therapy, often called IV therapy, is the delivery of medication, nutrition, or fluids through a vein. Medication, nutrition, or fluids either drip from a bag suspended on a pole or are pumped by a portable pump through a tube and into the vein. Chapter 7 has more information about IV therapy. Guidelines. Dressing a resident with an IV. Never disconnect IV lines or turn off the pump. The nurse will be responsible for unhooking IV tubing from the pump. Always keep the IV bag higher than the IV site on the body. First, remove clothing from the side without the IV. Then gather the clothing on the side with the IV. Lift clothing over the IV site. Move it up the tubing toward the IV bag. Lift the IV bag off its pole. Carefully slide the clothing over the bag. Place the bag back on the pole. Lift the IV bag off its pole. Apply clean clothing to the side with the IV. Slide the clothing over the bag. Place the IV bag back on the pole. Move the clothing down the IV tubing over the IV site and onto the resident's arm. Put the other arm into the clothing. Check that the IV is dripping properly. Make sure none of the tubing is dislodged. Check to see that the IV site dressing is in place. Make sure tubing is not kinked after you are finished. For cases of poor circulation to the legs and feet, elastic stockings are ordered. These stockings help prevent swelling and blood clots and aid circulation. They promote blood circulation by gently squeezing the legs to increase blood flow. Elastic stockings are also known as anti-embolic stockings or TED hose. They are referred to as anti-embolic because they help prevent embolisms. An embolism is an obstruction of a blood vessel, usually by a blood clot. The embolism can travel from where it was formed to another part of the body, blocking blood flow. It can cause serious damage and even death. Elastic stockings may either be knee-high or thigh-high. They need to be put on in the morning before the resident gets out of bed. Legs are at their smallest size then. The stockings are usually removed in the evening. Procedure: applying knee-high elastic stockings. Equipment needed: elastic stockings. 1. Identify yourself by name. Identify resident by name. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for resident's privacy with curtain, screen, or door. Maintains resident's right to privacy and dignity. 5. The resident should be in the supine position, on her back, in bed. With resident lying down, remove her socks, shoes, or slippers, and expose one leg. Expose no more than one leg at a time. 6. Take one stocking and turn it inside out, at least to heel area. Figure 6-29. Caption: turning the stocking inside out allows the stocking to roll on gently. 7. Gently place the foot of the stocking over the toes, foot, and heel. Make sure the heel is in the right place. The heel of the foot should be in the heel of the stocking. Figure 6-30. Caption: place the foot of the stocking over the toes, foot, and heel. Promote the resident's comfort and safety. Avoid force and overextension of joints. 8. Gently pull the top of the stocking over the foot, heel, and leg. 9. Make sure there are no twists or wrinkles in the stocking after it is on. It must fit smoothly. Make sure the heel of the stocking is over the heel of the foot. If the stocking has an opening in the toe area, make sure the opening is either over or under the toe area. This depends on the manufacturer's instructions. Adjust if needed. Figure 6-31. Caption: make stocking smooth. Twists or wrinkles cause the stocking to be too tight, which reduces circulation. 10. Repeat steps 6 through 9 for the other leg. 11. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 12. Wash your hands. Provides for infection prevention. 13. Report any changes in resident to nurse. Provides nurse with information to assess resident. 14. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Chapter 6. Continued. Learning Objective 6. Identify guidelines for proper oral hygiene. Oral care, or care of the mouth, teeth, and gums, is done at least twice each day to clean the mouth. Oral care should be done after breakfast and after the last meal or snack of the day. It may also be done before a resident eats. Oral care includes brushing the teeth, tongue, and gums, flossing teeth, caring for lips, and caring for dentures. When giving oral care, NAs must wear gloves. They should follow standard precautions. Figure 6-32. Caption: some supplies needed for oral care. Observing and reporting oral care. When performing oral care, observe the resident's mouth carefully. Report any of these to the nurse. Irritation, raised areas, coated or swollen tongue, ulcers such as canker sores or small, painful white sores, flaky white spots, dry, cracked, bleeding, or chapped lips, loose, chipped, broken, or decayed teeth, swollen, irritated, bleeding, or whitish gums, breath that smells bad or fruity, resident reports of mouth pain. Procedure: providing oral care. Equipment needed: toothbrush, toothpaste, emesis basin, gloves, clothing protector, towel or washcloth, cup of water, lip moisturizer. 1. Identify yourself by name. Identify the resident by name. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for resident's privacy with curtain, screen, or door. Maintains resident's right to privacy and dignity. 5. If resident is in bed, adjust bed to a safe level, usually waist high. Raise the head of the bed to have the resident in an upright sitting position. Lock bed wheels. Prevents injury to you and to resident. Prevents fluids from running down resident's throat, causing choking. 6. Put on gloves. Brushing may cause gums to bleed. 7. Place a clothing protector, towel, or washcloth across the resident's chest. Protects resident's clothing and bed linen. 8. Wet the toothbrush. Put on small amount of toothpaste. Water helps distribute toothpaste. 9. Clean the entire mouth, including the tongue, and all surfaces of the teeth and gum line. Use gentle strokes. First brush the inner, outer, and chewing surfaces of the upper teeth. Then do the same with the lower teeth. Use short strokes. Brush back and forth. Brush the tongue. Brushing upper teeth first lessens production of saliva in lower part of mouth. 10. Give the resident water to rinse the mouth. Place the emesis basin under the resident's chin, with the inward curve under the chin. Have the resident spit water into the basin. Wipe his mouth and remove the towel. Apply lip moisturizer. Figure 6-33. Caption. Rinsing and spitting removes food particles and toothpaste. 11. Rinse the toothbrush and place in proper container. Empty, rinse, and dry basin. Place basin in designated dirty supply area or return to storage, depending on facility policy. 12. Place soiled clothing and linens in proper containers. 13. Remove and discard gloves. Wash your hands. Provides for infection prevention. 14. Return bed to lowest position. Remove privacy measures. Lowering the bed provides for safety. 15. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 16. Report any problems with teeth, mouth, tongue, or lips to the nurse. This includes odor, cracking, sores, bleeding, and any discoloration. Provides nurse with information to assess resident. 17. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Even though a person who is unconscious cannot eat, breathing through the mouth causes saliva to dry in the mouth. Oral care needs to be performed more often to keep the mouth clean and moist. For a resident who is unconscious, the NA must use as little liquid as possible when giving mouth care. Because the person's swallowing reflex is weak, he is at risk for aspiration. Aspiration is the inhalation of food, fluid, or foreign material into the lungs. Aspiration can cause pneumonia or death. Turning an unconscious resident on his side before giving oral care can also help prevent aspiration. Only swabs soaked in tiny amounts of fluid should be used to clean the mouth. Procedure: providing oral care for the unconscious resident. Equipment needed: sponge swabs, tongue depressor, towel, emesis basin, gloves, glass of water, lip moisturizer, cleaning solution. Check the care plan. 1. Identify yourself by name. Identify the resident by name. Even residents who are unconscious may be able to hear you. Always speak to them as you would to any resident. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding. The resident may be able to hear and understand even though he is unconscious. 4. Provide for resident's privacy with curtain, screen, or door. Maintains resident's right to privacy and dignity. 5. Adjust bed to a safe level, usually waist high. Lock bed wheels. Prevents injury to you and to resident. 6. Put on gloves. Protects you from coming into contact with body fluids. 7. Turn resident onto his side. Place a towel under his cheek and chin. Place an emesis basin next to the cheek and chin for excess fluid. Protects resident's clothing and bed linen. 8. Hold the mouth open with the tongue depressor. You can also use gentle pressure on the chin to open the mouth. Follow facility policy. Enables you to safely clean mouth. 9. Dip the sponge swab in the cleaning solution. Squeeze excess solution to prevent aspiration. Wipe the teeth, gums, tongue, and inside surfaces of the mouth. Remove debris with the swab. Change the swab often. Repeat this until the mouth is clean. Stimulates gums and removes mucus. 10. Rinse with clean swab dipped in water. Squeeze swab first to remove excess water. Remove solution from mouth. 11. Remove the towel and basin. Pat lips or face dry if needed. Apply lip moisturizer. Prevents lips from drying and cracking. Improves residents' comfort. 12. Empty, rinse, and dry basin. Place basin in designated dirty supply area or return to storage depending on facility policy. 13. Place soiled lip in the proper container. 14. Remove and discard gloves. Wash your hands. Provides for infection prevention. 15. Return bed to lowest position. remove privacy measures. Lowering the bed provides for safety. 16. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 17. Report any problems with teeth, mouth, tongue, or lips to the nurse. This includes odor, cracking, sores, bleeding, and any discoloration. Provides nurse with information to assess resident. 18. Document procedure using facility guidelines. If you do not document the care, legally, it did not happen. Flossing the teeth removes plaque and tartar buildup around the gum line and between the teeth. Teeth may be flossed immediately after or before they are brushed, as the resident prefers. NA should follow the care plan's instructions for flossing. Procedure: flossing teeth. Equipment needed: dental floss, glass of water, emesis basin, gloves, towel. 1. Identify yourself by name. Identify the resident by name. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for residents' privacy with curtain, screen, or door. Maintains residents' right to privacy and dignity. 5. If resident is in bed, adjust bed to a safe level, usually waist high. Raise the head of the bed to have the resident in an upright sitting position. Lock bed wheels. Prevents fluids from running down resident's throat, causing choking. 6. Put on gloves. Flossing may cause gums to bleed. 7. Wrap the ends of the floss securely around each index finger. Figure 6-34, caption: before beginning, wrap floss securely around each index finger. 8. Start with the back teeth. Place the floss between the teeth. Move it down the surface of the tooth. Use a gentle sawing motion. Figure 6-35, caption: being gentle protects the gums. Continue to the gum line. At the gum line, curve the floss. Slip it gently into the space between the gum and tooth. Then go back up, scraping that side of the tooth. Repeat this on the side of the other tooth. Removes food and prevents tooth decay. Figure 6-36, caption: floss gently in the space between the gum and tooth. 9. After every 2 teeth, unwind the floss from your fingers. Move it so you are using a clean area. Floss all teeth. 10. Occasionally offer water so that the resident can rinse debris from his mouth into the basin. Flossing loosens food. Rinsing removes it. 11. Offer resident a face towel when done flossing all teeth. Promotes dignity. 12. Discard the floss. Discard the water and rinse and dry the basin. Place basin in designated dirty supply area or return to storage depending on facility policy. 13. Place soiled linen in the proper container. 14. Remove and discard gloves. Wash your hands. Provides for infection prevention. 15. Return bed to lowest position. Remove privacy measures. Lowering the bed provides for safety. 16. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 17. Report any problems with teeth, mouth, tongue, or lips to the nurse. This includes odor, cracking, sores, bleeding, and any discoloration. Provides nurse with information to assess resident. 18. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Dentures are artificial teeth. They are expensive. Dentures must be handled carefully to avoid breaking or chipping them. If a resident's dentures break, he or she cannot eat. The NA should notify the nurse if a resident's dentures do not fit properly, are chipped, or are missing. The NA must wear gloves when handling and cleaning dentures. Dentures and denture brushes should not be placed on contaminated surfaces. Once dentures are cleaned, they should either be returned to the resident or stored in denture solution, or in clean, moderate, cool water, not hot water, so that they do not dry out and warp. Dentures may crack if left uncovered. Dentures should be stored in a denture cup labeled with the resident's name and room number when not being worn. They should not be removed from the resident's room. Residents' Rights, Box 6-2, Denture Care. Denture care is very personal. The NA should pull the privacy curtain and close the door before beginning. Many people who have dentures do not want to be seen without their teeth in place. After teeth are removed, they should be cleaned and returned immediately. Procedure: cleaning and storing dentures. Equipment needed: denture brush or toothbrush, denture cleanser or toothpaste, labeled denture cup, 2 towels, gloves. 1. Wash your hands. Provides for infection prevention. 2. Put on gloves. Prevents you from coming into contact with body fluids. 3. Line the sink or basin with a towel and partially fill the sink with water. Prevents dentures from breaking if dropped. 4. Handle dentures carefully. Hold them over the sink. Rinse dentures in clean, moderate, cool, running water before brushing them. Do not use hot water. Hot water may warp dentures. 5. Apply toothpaste or cleanser to the brush. 6. Brush dentures on all surfaces. This includes the inner, outer, and chewing surfaces of dentures, as well as the groove that will touch gum surfaces. Figure 6-37, caption, brush dentures on all surfaces to properly clean them. 7. Rinse all surfaces of dentures under clean, moderate, cool running water. Do not use hot water. Hot water may warp dentures. 8. Rinse the denture cup and lid before placing clean dentures in the cup. Removes pathogens. 9. Place dentures in clean, labeled denture cup with solution or moderate cool water. Dentures should be completely covered with solution. Place the lid on the cup. Return the cup to where it is stored. Some residents will want to wear their dentures all of the time. They will only remove them for cleaning. If the resident wants to continue wearing dentures, return them to her. Do not place them in the denture cup. 10. Rinse the brush. Clean, dry, and return equipment to storage. Drain the sink. Place soiled linens in the proper container. 11. Remove and discard gloves. Wash your hands. Provides for infection prevention. 12. Document procedure using facility guidelines. Report any change in appearance of dentures to the nurse. If you do not document the care, legally it did not happen. Orange Box 6-1. Removing and reinserting dentures. If a resident cannot remove her dentures, the NA must do it if trained and allowed to do so. The resident should be sitting upright before beginning. The NA should first don gloves. The lower denture should be removed first. The lower denture is easier to remove because it floats